Hi everyone, I am Dr. Waseem Sajjad. I am a diagnostic and interventional radiologist, and today we discuss about the basics of ultrasound. This lecture is very important for sonographers, sonologists, and the basic ultrasound learners. They can be physicians, the surgeons, the gynecologists who are trying to start their basic ultrasound. So, ultrasound is the very useful and one of the best imaging modality till date. Till date, no other imaging modality can replace ultrasound when it comes to the real-time diagnosis. But unfortunately, ultrasound is operator dependent. The more experienced and the more expert the operator is, the more useful the ultrasound modality will become. So, in this lecture, we focus how a physician or a sonographer can learn the basics of ultrasound and start doing ultrasound independently. The very important concept of ultrasound is that it uses ultrasound waves to form images. The basic theme is the ultrasound probe transmits the ultrasound waves at a certain frequency, and these ultrasound waves are reflected back from the structures inside the body, and these reflected ultrasound waves are again received by the ultrasound probe and appear as image on our ultrasound screen. So the basic thing which we encounter in ultrasound images is the echogenicity. The concept of echogenicity is the base of ultrasound. What is echogenicity? Echogenicity is nothing. It is just the ability of the structures inside the body to reflect, absorb, or transmit the ultrasound waves. So, as a general rule of thumb, the more reflective a surface is, the more echogenic it will be, and the more bright it will appear on the ultrasound screen. So, on grayscale ultrasound, we have two extremes. The one is black and the other is bright. So, the image is a different shades of black and white between these two extremes. So the better we understand how these shades are formed, the better we will diagnose the different pathologies inside the human body. So which shade means which pathology or which morphology of the human body is the basis of ultrasound. So we often say that the thing is hypoechoic, hyperechoic, isoechoic. What is the echogenicity? What degree the thing or structure inside the body reflect the ultrasound waves is the echogenicity of the object. So suppose if a object inside the human body reflects the ultrasound waves. Suppose it reflects all of the ultrasound waves which are being thrown to that object. All the ultrasound waves are reflected back and received by the probe. Then the image will be appear as very bright. If the ultrasound waves are transmitted through this object, then the degree of transmission will determine which shade of black and white the image will appear on the screen. Suppose if all the ultrasound waves pass through the object will appear black. If 50% of the ultrasound waves are reflected and 50% are transmitted, then the object is a shade between black and white. And this information tells us that composition of the object. Suppose if a thing appears bright on the ultrasound screen, it means it is reflecting all the ultrasound waves, and it indirectly means that either the object is solid or the object has very reflective surface. So if the object is very solid, then it can be a stone, it can be a very hard tumor, and it can be any hard thing which is reflecting the ultrasound waves. And if a thing appears black on the ultrasound screen, it means the ultrasound waves are being transmitted through the object. And it means the object is not reflecting the ultrasound waves. It can have a low reflective index. So the shade of the gray which appears on the ultrasound screen indirectly tells us about the composition of the structure which is being imaged. And if you are expert and competent enough to analyze that which shade of gray will appear on ultrasound and it correlates with which type of composition of the object, we can tell it is a hard object, it is a soft object, it is a liquid, it's a stone, or it's a other human organ structure, because the reflectivity of every structure is unique, and this uniqueness determines that our diagnosis. For example, the liver has a unique echogenicity. If the fat content of the liver is increased, then the echogenicity of the liver is increased because the fat reflects the ultrasound waves. So if the liver appears bright on the ultrasound screen, it means there is something inside the liver which is reflecting the ultrasound waves. And in 99.9% cases, it is the fat. So if you see a liver which is more bright than its unique echogenicity, it means the fat content of the liver is increased. We will study all these concepts one by one. So, how accurately and how expertly you correlate the brightness or darkness of the ultrasound image to the composition of the object, the more accurate you will be in diagnosing the composition of the object. The next very important step in learning ultrasound is the probe handling. Probe handling is very important and very technical and the core concept of ultrasound learning. When you learn how to handle the probe properly, your 50% ultrasound learning is complete. So when we see the ultrasound probe, an ultrasound probe has two ends. One is the pointing end and other is the non-pointing end. And similarly, the ultrasound screen also has the two ends. One is the pointing end and one is the non-pointing end. On probe, there is a pointer which determines which is the pointing end. Similarly, on the screen, there is a mark which determines which is the pointing end. So, when we place a probe on the human surface, the things which are under the pointing end of the probe will appear along the pointing end of the screen. So if we are placing the probe like this, and the structure which is this is the pointing end, and the structures which under this pointing end is the liver, so the liver on the screen will appear towards the pointing end. So it is not necessary that you always place the probe like this. You can reverse the probe as well, but then your image on the screen will also get reversed. Your diagnosis will remarkably change how you place the probe on the human surface. So you should understand that when you place the probe like this, how the images will appear on the screen, and when you place the probe like this, how the images will appear on the screen. So these are the two basic concepts of ultrasound. The first is echogenicity and the other is the probe handling and the probe orientation. When you are able to grasp and fully understand these basic concepts, then ultrasound is nothing. If you know the pathologies and you know these basic concepts, then the ultrasound will be very easy for you. So I hope that this echogenicity concept and this probe orientation concept will help you in the coming lectures, and you should keep it in your mind that these is very important, how you place the probe and how bright or how dark the image appears on your screen, and that two things will define your diagnosis and will define how competent you are. Thank you.